Thank you. And it's really such a pleasure to be here. I've had such a great morning. It's been wonderful to listen to the other health commissioners and to researchers who tackle, thorny issues and seek to connect them to practice. As you've heard, I was here for the first of these symposia, and I am back now 10 years later. At that time, I was a New York City Health Commissioner. This time, I'm a professor at Harvard University. I direct a Center for Health and Human Rights. So I would like to think that human rights and the rights framework has a direct bearing on what we're talking about today and identifies appropriately the resources for health, but I'm no longer directly involved with urban health. So I'm going to do a sort of reflective talk to you today, and I'm going to be political here. So before I get started, I have to say, as required by my university's institutional voice principles, that I am speaking in my own capacity as a member of the faculty, and that my words do not reflect the official position of Harvard University. So I'm going to start out with a couple of propositions. And the first, of course, is that public health is political. And we've seen that very clearly in recent years. With COVID, we saw the city resurrected as a center of disease transmission from Wuhan to New York. And we have seen with the huge budget cuts that Trump's war on cities, as some have described it, with his goal of building beacons of hope, safety, and beauty, that these budget cuts will indeed undercut the role of a city as a beacon of science, education, and culture. So cities will be very hard hit in the current period. But I want to make it clear to all of you, and I'm sure many of you know this, that public health has always been political. And that's because public health takes place at the interface of science and society. And its greatest accomplishments have always been rooted in social justice and have been structural in origin, necessarily bringing politics into the picture. I believe quite strongly, and maybe we can talk about this, that it's not simply a matter of better communication of the science. We have to acknowledge that the drivers of ill health that are often structural in origin are ones that are by necessity political, and that some of the greatest advances that we've seen in public health have been when we see public health aligned with social movements. So the other proposition that I want to put to you is that urban health is now health for everyone around the world. The urban setting is where we now live. It's a dominant form of human settlement, and it is increasingly the dominant. And we've heard several types of statistics already this morning about how the urban setting is coming to dominate how we live now. So our role is to protect the importance of cities to our lives and to our health, and to protect them very fully. I was looking at the phrase urban public health, and we have definitions that I've used over my working life to define health. Probably many of you are familiar with this one. Or to define public health. Both of these definitions are really almost poetic in their description. They're neither of them very subject to measurement. And then we get to urban, and there we see the numbers. I think all of us agree that density and population size and the notion of geography are very important to the idea of urban, but they're not the only parts of what we think of when we think of the urban setting. And so I've been thinking about how other disciplines might reflect on what it means to be urban. I don't know if there's anybody in the audience who remembers Eddie Palmieri. No? Anybody? We just lost him. And some of you may remember his song Harlem River Drive. And it contains the words, and it starts with police sirens, this piece, and it contains the words, several shades of living from diamonds to mud. And I thought maybe but I couldn't figure out a way to play you music. So I thought that I would use instead photography and art. And this begins with Jacob Riis, an iconic photographer in the late 19th century of New York. He took pictures in the tenements of New York City, documenting how the poor lived, always with a human face, showing the inadequacy of housing, the crowded, filthy alleyways. I'm pretty sure, I don't know if you can make it out there, that's a carcass there on the left side of the photograph. And this is a later depiction of New York City. And it also shows how densely built the population is, the crowds of people, the mixing of people and commerce. Abstract artists also conveyed the dense, built environment that we've come to think of as associated with cities. And we have Edward Hopper, who does a much more austere presentation of the built environment. Some years later, Romar Bearden, one of the Harlem Renaissance painters, echoed the role of buildings in the cityscape. And this is a picture of his from a home mural he did called The Block. Hopper also showed the social isolation and loneliness that we can see in cities. And I pulled images mostly from the US, mostly from New York City, but we see other images like these. This is Japan, showing people on sidewalks, around buildings. This is Myanmar, demonstrating the diverse economic activities that we see in cities, including very poorly regulated economic activities. Zimbabwe, with the crowds and the transport issues. And a very hopeful image of cities came from Ralph Fancella, also a New York artist. There's life there in every single window. And he also captured the city as a site for labor activism. This is people gathering for a strike action. He showed the importance of public recreation to urban life and the way in which public places become a place where people can interact across race and class lines. He highlighted the importance of recreation in urban areas, and many of you may not know that Article 24 of the Universal Declaration of Human Rights is about the right to leisure. And he showed baseball stadia, and the subway makes it into the images of the city. This is a social realist depiction. Fancella, again, showing how the subway becomes a place where people who are strangers to each other come into quite intimate contact, touching each other, bringing people together across different ages and walks of life. And they're grimmer images. Luis Valdez is a prominent and important Chicano artist. Many of you may not be aware that the Klan did make it into urban areas, and he demonstrates this in this image. There are women and babies in this depiction of the Ku Klux Klan. And here is an image of decay with a barrel with a fire. So I just realized listening this morning that I didn't find an image of air pollution. But I'm sure there is an artist who has depicted that. And I think that you would agree with me that the artist captures the many senses of urban that our numbers fail to, and highlight and lift up the importance of the urban setting as a way of living, that it includes elements that none of us can engender on the household level, that the bustle, crowding, interaction of people across many different walks of lives are what gives cities their wonder. And they're captured perhaps better by artists than they are by our definitional numbers. So I also want to say that we're headed to just about everybody living like this in the United States and a large section of the world. I saw in somebody's presentation that we expect 85% of Europe, 70 to 75% of the world to be living in urban areas in just a generation. So while the US is my focus today, and I think we have to talk about pretty explicitly what's going on here. I hope that what I have to say has relevance to all of you. You know, this is how the New York City Health Department has published its vital registration every year. New York is fortunate that it has its own vital registration. It's the only local jurisdiction in the country which does its own vital registration, and I guess I didn't have my animation right. You see that blue there. You can see in the 19th century the endless outbreaks that plagued New York City, and then how in the beginning of the 20th century that really leveled out. COVID, although New York City lost many lives, is that one blip there at the end, not nearly as remarkable as the impact of pestilence in the city in earlier days. And that is attributable to public health. It was public health that brought an end to this, not, and vaccination is important, but critical to this were the structural improvements in people's lives. I thought I would focus on the top 10 cities in the United States. You can see that New York City is by far the largest, twice as large in population as its nearest city, which is Los Angeles. Philadelphia is there in the middle, ranked number 5. Together, these cities comprise about something under 10% of the population of the United States. Now, these cities are largely blue. This, which I hope you can read, shows that in the top cities, virtually all of them except Dallas, have a Democratic mayor. Dallas has a nonpartisan election process, and the mayor was elected as a Democrat, and then after a certain November election decided to become a Republican. But they also have legislatures, meaning their various city councils that are Democratic. And many of them, but not all of them, are in states where they have a Democratic mayor. That's what we mean by a trifecta. That means that the governor, the legislature, and the executive, the mayor, the governor and the legislature are all members of one party. And you can see that many operate not only have a Democratic city government, but are in a Democratic state. That means there we go. And in addition to the cities being mostly blue, there are other characteristics of the city that I think are important to acknowledge. One is that among these top 10 cities, there are only 2 that are not majority-minority, by which I mean that no group constitutes a majority of the population. In Phoenix, the majority, not by much, of the population is white. and in San Antonio, the majority of the population is Latino. But in most cities, there is no majority group, which also says something about how the democratic process has to work in these settings. The other thing to note in this is that the cities have large sectors of the population that are very low income. The federal poverty line is totally inadequate. It's now, I believe, about 32,000 for a family of 4. So very often we use 200% poverty. You can see in New York, actually, and also here in Philadelphia, the majority of the population live at or near poverty. And as a consequence, in almost all cities, people are severely rent burdened, and that, of course, is related to the problem of people being unhoused. Finally, well, actually, there are 2 more points. These are immigrant cities. In New York City, 38% of the population is foreign-born, and immigrants with their children comprise more than half of the population. And all of the major cities have large immigrant populations. And their leadership reflects the people who live there. These cities are led largely by people of color. There are 4 women. There are at least 2 people who are openly gay. So the mayors of our major cities reflect the cities that they lead. And you know, you're all aware that we have seen the fact that while cities are democratic strongholds, the states have been shifting red, and our country is increasingly polarized. There are only 10 states that have a blended government, meaning that one party doesn't control the legislature, and which typically has two houses, and the executive. But increasingly, and I had another slide that's in there somewhere, I think, that shows very clearly the growing dominance of Republican trifectas that has been occurring now for over a decade. So the US cities are beacons of progressive thinking, and they're also centers of groups that are under threat, including immigrants, people of color, and additionally, very vulnerable populations in the sense that many live in official poverty or near poverty, with the result that we see large disparities by race and income in all of our cities. And we heard about that this morning from the groups. So we have seen the concern that all of us have about the cuts in social benefits. But other actions are going to have a severe impact on cities. The elite universities, many of them, are located in cities and are facing substantial threat in terms of budget cuts. Our cultural institutions are often located, actually overwhelmingly located in cities. So while social expenditures will reduce the access to care, dismantle our healthcare infrastructure, and cost jobs, so will these other actions that affect universities and cultural institutions. I don't need to remind anybody in the audience of the types of images that we saw last June when members of the armed forces, that's the Marines and the National Guard, appeared in Los Angeles over the protests of the governor and the mayor, and more recently, in fact, ongoing in DC, although there was a court case for Los Angeles. now we get to see iconic monuments of government flanked by military vehicles in Washington, D.C., as the National Guard has been dispensed. I just saw that the Washington, D.C. has sued over the deployment of the National Guard. And other cities have been promised that their turn will come. And they all tend to be led by African Americans. And we are told that the next one is going to be Chicago. The governor of Chicago the governor of Illinois has joined the mayor of Chicago in saying that this shouldn't happen. I also expect that you're also aware that the National Guard in Washington is now carrying weapons. Pritzker in Illinois invoked the experience of an elected individual. His name was Adolf Hitler, who became an authoritarian figure in a very short period of time after his election. I think we've seen more resilience of our democratic structures than that. But all of these cities have noted that the reason being offered, the desire to make cities beautiful, safer, and so on, invoking many racial tropes, describing cities as cesspools and so on, are not matched by the data. And in fact, the data show that crime rates are improving. Before I move on to what we ought to be doing about all this, I have to also note the impact of the cuts to global health, because these won't end with those countries. We live in a globalized world. Our cities are the gateway, and the withdrawal from the World Health Organization and the USAID cuts will increase the risk in those countries and the risk to us. The mortality impact of these cuts is reckoned in the millions, and the US, of course, is being deprived of all of the accolades that it gained by its pioneering role in making antiretroviral drugs available. The CDC is under renovation. Science is being questioned, including the use of our mRNA technology, the scientific benefit of vaccines. I think that the experts have all, at federal level, have all mobilized facts and science to argue against these decisions. But the dismantlement of the CDC, which is our global and domestic public health agency, is severe. And of course, there's the threat of the Medicaid cuts. They will have a larger impact in rural areas, but this graph is to remind us that 20% of urban areas individuals are covered by Medicaid. I've pointed out to you how many people are low income who live in cities, and they get their health insurance coverage by Medicaid or combined insurance. So the planned reductions to Medicaid will increase the uninsured by millions and lead to thousands of preventable deaths. And the way that they're going to do this is by making it much harder to be eligible for Medicaid, not changing the criteria, but saying that you have to work. A third of the savings will come from the imposition of a work requirement for the Medicaid expansion states, and people won't be able to comply with that, and as a result, it's being estimated that they will, save us money and not have health insurance. We also are seeing cuts to SNAP or food stamps. So, in New York City, this is going to be big. There are about 8.3 million people who live there, and 5 million of them either get their care through the Affordable Care Act or through Medicaid. And it's not just the public sector that will be hurt. 2/3 of revenues from the private hospitals in New York City come from public insurance. So when they lose revenue, they pass on the budget reductions in terms of lost jobs. The state is estimating that New York City will lose something like 33,000 jobs. And this slide is to remind me that the cities are also adversely affected by the climate crisis. This was something that the artists didn't know about, most of them, and one which has led to all these really astounding images of flooding and fire in our cities. So that's a lot of context. And I hope a sort of a call to action for the defense of cities as a place of hope, exuberance, culture, and education. This is a map that I often used as the New York City Health Commissioner, and I don't expect that you'll be able to read all of that. But I think you can see that there are neighborhoods that light up because they're darker than all the others. And they're probably neighborhoods that you've heard of even if you don't know New York City. They're the South Bronx, Harlem, Central Brooklyn, and the conditions that are pictured in these series of maps, which to me remain a really powerful way to convey information, are asthma hospitalizations for children, HIV/AIDS deaths, diabetes, and drug hospitalizations. So these are conditions that are not related, but yet they occur at the highest rates in the same neighborhoods over not just a handful of years, but over generations. And to me, this map is one of the best ways of displaying how structural issues are what drives the health of populations. So when we talk about how we should be tackling health in the urban setting, we focus on the power of place, the fact that segregation in our cities means that we can use targeting by place to reach groups that are experiencing the worst outcomes, that they require working together across multiple sectors and tackling multiple outcomes. That it means that we don't have just one way to think about how to improve health. And that map, if we lived in a more equitable society, would not look like this. It would not be all these different colors. So equity is always a part of how we think about public health. And the last point is the importance of acknowledging that no one has a higher stake in improving the health of populations than the people who live there. So that we should never think that we are, arriving with the solutions that we can divulge to people without their involvement. And our goal is to identify and collaborate with power-building organizations. And these may not always be the usual suspects. They may not be the ones that have learned how to contract with city governments. So it seems to me that these are the sort of ways that we can begin to tackle the health in the urban setting. And the cities at local levels, as you heard from the leaders of health departments this morning, have tools. Most health departments have a board of health, or the only one that doesn't is San Jose. And I'm pretty sure that Santa Clara was the first county to declare the shutdown during COVID. I can't remember. But so there are local authorities as well as local political jurisdictions. And the other thing that cities have is data. And this is how New York City used its data. And I pointed out that New York City is sort of special in having more data than many other cities, and it's a rich city as cities go. But making data available at community level, making data available on specific population groups, so that they can advocate for their health. The middle was about emergency preparedness. I'd be happy to explain it. And issuing out summaries that were easily digestible. And so I often said to people at the New York City Health Department, and you'll hear from the current health commissioner, but she's the fourth since I left. So that I would cut programs before I'd cut data collection. Surveillance is really critical. But government has other tools. Tax often requires the engagement of the state, but Philadelphia became the first city to tax soda and earmark that tax for early childhood. The taxation of tobacco has, and you can also do it with minimum pricing, has been a really important part of lowering tobacco use. Often cities have more control over property taxes and other things, mainly through the evaluation of the property. And I don't know if any of you own property. I happen to. And the market value and the taxable value of my house are very far apart in my favor. So the city has the ability to address that. And of course, there's legislation and regulation, with regulation being a critical part of how local authorities can act through their inspection programs. We heard about the ability to intervene and make sure that people got their tangled title untangled. You'll hear maybe about cooling towers and the risk of Legionnaires. New York City just declared its Legionnaire outbreak over. Those are all places that are regulated. These are things that are controlled by the elected officials and what are supposed to be independent boards of health. And the other one is a very underused tool of local governments, which is procurement. The local governments spend a lot of money, even if they're always cash-strapped. And the ability to use procurement for meals, to leverage the cost of the purchasing power of insurance, to address the price of prescription drugs, even to think about how to ensure, for example, the city workforce. So a lot, and these are all slides from my time as health commissioner, can be done by using policy. Policy is not cheap, but it's much more expensive from the point of view of political capital than it is in terms of financial capital. So it's really important that policy approaches be engaged with. This is the famous calorie posting, which I think is supposed to be national now, the labeling for sodium content, the ways in which New York City sought to accelerate the decline in adult smoking. It's now below 12%. It was halved in 20 years. And that's me with a standing order for naloxone with a young man who survived an overdose. So the other part of what I would recommend as a way forward in these times is grounding with communities. You heard in Dr. Hunt's introductory remarks that I made a real effort, and this continues to this day. So this is 6 health commissioners later. The health department has buildings in a number of neighborhoods around New York City, and in 3 neighborhoods, the ones you saw light up there on the map, these were rebranded as neighborhood health action centers and became really places where people could get information and services, a place where the high-cost services of the city were concentrated. When there was a need to reduce expenditure, use the lens of equity to decide what community needs these services the most. We know at least that will help reduce disparities. New York City is seeing a living example of creative ways of communicating. We also need to get better at that. In general, I would say that government efforts at communication are stodgy. And so we tried, and I expect that they're doing that. I don't know if you can make this out. I was really keen to put, peaches and avocados on as part of our STI campaign. They wouldn't let me put it on the television. But we put it on the subways. And once I was riding the subway and I heard a parent say to a kid, this one reads, whether it's a fling or a serious thing, and then it's somebody texting you up, and then is this a peach call? And then it says, get tested. And she says to her kid, what is that about? And so anyway, trying to use humor, trying to convey information in a way that's empathic. All of these are important, but I was not. I was way behind on the use of all these things that we're seeing. The young Mamdani has perfected in New York City, and Mr. Cuomo is trying to replicate. But these ways of communicating are really important. Something else that is not about workforce wellness in the way we were discussing it this morning is an effort that was undertaken and is still going on at the New York City Health Department, is something we call the Race to Justice. It was first called by me internal reform. So you can see that we did have some people who were better at communicating. And that was about educating people about the history in this country, which many people don't know. And certainly at a place like the New York City Health Department, where a large share of the workforce were immigrants themselves, had never been exposed to. People come to the United States with an image of the United States that doesn't include the history of conquest or the history of use of enslaved labor, the adoption of Jim Crow, which was a U.S. form of apartheid. So we began a real effort to educate our workforce about these things, with guest speakers, and with asking everybody to apply a racial justice lens to their work. Not just the programs, but finance, procurement, HR, all of them were IT. You would be amazed at the kinds of ideas that people come up with when they're challenged to do something. And all of this continues to this day, and it had a huge impact on morale. Because people, we also were helped by circumstances in a way, if you can call it that. Ferguson happened under my watch. But this became built into the evaluations of people. In the civil service, we have a format of evaluations. And there was a required training that everybody who, just like they had to get some training in emergency preparedness and response, they had to get this training. So these sorts of things remain under local control. And I think we heard this morning that these things can still be done, even when the political context becomes really adversarial. And I put this in because it seems to me that some of the things that we really need to continue to focus on are children. And I can't remember which one of the health commissioners, I think it was the Philadelphia health commissioner, who said that we really have to continue to preserve programming that protects children. Now that's a whole wide toddlers are the ones who toddle around and eat paint chips. So it involves more than breastfeeding and safe pregnancy and delivery. But I think that we ought to be able to continue somehow to preserve those services. We need to keep working with communities where they are. This was a Vogue Ball that we did every year they probably still do it, but I wanted to highlight it because this is Dimitri Daskalakis, who just resigned as the director of the Center for National Center for Immunization and Respiratory Diseases. He's the guy in the hat, probably telling me to wind up. So the practice of community engagement is also something that can be highlighted and required by leadership. These are a couple of little vignettes. First of all, people always say that it takes too much time to work with communities. They're not organized, they don't, people don't show up. But this is an example of bike lanes in Bed-Stuy, one of those neighborhoods that had has among the bad outcomes, red-colored neighborhoods. And so they were told that the Department of Transportation was going to put in some bike lanes. The colors are not good. You can't distinguish the Transportation Department's bike lanes from what the community came up with. But the community was hostile. The residents said, we don't want those people in spandex riding through our neighborhood, and they're facing gentrification. And the business community said, they mess up our deliveries. We don't want these bike lanes. And they began a negotiation that was brokered by the Neighborhood Health Action Center. And the Department of Transportation promised that they would do what the community, the outcome of that negotiation that they would live with. And the community asked for an additional 7 miles of bike lanes. And they also asked for more racks with those, with the bicycles that are in the New York City's bike program. So they got even more than the DOT got a better outcome than they began with. And an Intercept study showed later that 70% of people were riders from the neighborhood. And I also, and somebody else talked about it, or maybe you're going to hear about it from Dr. Dean tomorrow. There is, New York City undertook a conditional cash transfer program. It was a disaster, but it was my idea, but it not implemented the way I wanted. But I think that there's a growing interest in income supports as a way of tackling problems rather than pure, listening to the idea that everybody needs more and more services. Another example of how a city can pull together its resources, not with $0, but not nearly as expensive as it might be, was the response to child drownings, which fortunately are quite rare, but happened overwhelmingly among Black and Latino children. Schools had pools, very underutilized pools. The Parks Department had lifeguards, and the New York City Health Department was distressed that they had to investigate any more drownings, and on their own, without any involvement of the commissioner's office, the people who investigated these drownings went out, got everybody together. I didn't put on this slide, I don't think, but they also got private donations for all the gear. And these are the kids who were learning how to swim. These are the ways in which we can leverage assets and have people work together for some added cost, but not nearly as costly as a program might be. This is Josephine Baker, not the famous one, obviously. She said that she once saw Josephine Baker's photograph and understood why people wished that she were Josephine Baker. But she started the Bureau of Child Hygiene in New York City and ran that bureau after World War I. And, without many resources, came up with a whole slate of programming that we continue to see as really core to health departments. She started the school health program in New York City that was replicated around the country. She worked to try and integrate midwives into the delivery system, something that we're still struggling to do, and which I failed to do as a New York State Health Commissioner. So, the mantra of cities as site of innovation should be one that we all hold on to, but it's also not new. We're in a proud tradition of innovation in city health departments and across city agencies. I would say preserve data, something we didn't ask people about today, use policy levers, focus on neighborhoods, and continue programs that are critical to safety. We have to keep doing restaurant inspections and worrying about lead paint. And we should probably, I would think that a continued investment in childhood. I thought I would just remind you that in New York City, huge crowds of people still gather in the city's parks, and that people still go to the ballpark, and they go to the farmer's market, and we still have artists who portray the city as a place of dynamism and public transport. Okay, so that's it for me. Thanks. I probably have used almost all of my time. I guess we have 5 minutes.
So we do have some time for questions, and I think there's a mic being passed around.
Gosh, I should have talked longer if you all don't have any questions.
Thanks. Okay, yeah, I'll just project more. Thanks, that was fantastic. What generates political capital for departments of public health now? Especially in these times.
Yeah, that's a very good question. And I was never able to get an agreement from my mayor that sometimes spending political capital is a worthwhile investment in building political capital. And that's, what builds political capital is trust and results. When people see that your effects are good for them. But it's often many of the things that I talked about as wins in New York City, and they've been wins all over the country, like in tobacco control. Bloomberg was told, and I have no reason not to believe this is a true story, that he would lose the next election if he went forward with banning tobacco use in restaurants and bars. That's how costly his team thought that decision would be for him. But he then, he went ahead, and he has resources that most mayors don't have. And he, as a result, I think, became known as a public health mayor and switched his focus from judge me on how well I do with education, which I can't say he succeeded at, to how well I did, he did in health. So, I think that that this is where communication comes in. It is important, but I don't think that it can ever change the political dynamics around us. And to be honest with a mayor and say, this will cost you capital, but I think you'll win on it. In the end, it will be worth it. But not every mayor is going to go for that, unfortunately. It's a good question. I wish I had a better answer.
We have time for a couple more questions.
Thank you. Yeah. Thank you, and thank you for the great talk. I'm reminded now with the public health mayor and all of that of I think it was last symposium or the prior one where we had here Tom Farley talking about the soda tax in Philadelphia, which you mentioned, and he talked about the whole process of it. And one of the things he said that I'm still thinking about that is this was not a soda tax. This was a universal pre-K program.
Yeah.
Happened to be funded by a soda tax. So
good point.
One of the things he said is that by framing it in other things, with some health co-benefits, you may need to spend less political capital. You actually gain some of it because you're now giving pre-K. Everyone loves children, more or less. So I'm wondering if you had any
Yeah, no, I
examples
think
of
that's a good example of communications. I knew Tom Farley. I succeeded him as New York City's health commissioner, and he told me that the mayor told him, just stay out of this. I'm going to do this. I'm doing it as universal pre-K, and just and there are now 8 jurisdictions, I think, that use this as a funding mechanism for universal pre-K, and that's a much better way to frame it. But I don't think that we can get away from the fact these were all flat taxes that are not fair in the sense that they have a bigger impact on low-income individuals. But in my mind, when it keeps you from drinking sugar-sweetened beverages and smoking cigarettes, it's a good deal. But there are people who object to it on that grounds. And I don't think we can get away from the fact that tax is the principal way that we reorder the unfairness that's generated by our economy. So I don't know it might be good never to mention taxes, but I don't know how people are going to do taxes on the upper, that 0.1% have really fallen. And they used to pay so much more and still got to be very rich. I think somehow we have to let people know about the ways in which taxation has been going and who's bearing its burden now and who's not. But it was smart to sell this as a universal pre-K program. The new mayor, I hope, that's why I'm not speaking on behalf of Harvard University, will face huge challenge meeting the mandate that he's adopted without taxes. I don't know how else he'll do it. I guess so.
So we have time for just one more kind of quick question.
Thank you so much for your presentation. I have a question expanding on the issue of political capital. I was, very intrigued by the title of your presentation, and I'm wondering, given your experience in both public health practice and now also in academic public health, what do you see as some of the political investments or the contrast and compare political investments in these two different sectors? Or I often hear our students thinking about the kinds of, if you go into science, then that's not political, but science is political too.
Of course it's political.
Academic is political. So
yes.
I'm wondering if you could share with us any examples of the
I'm not witnessing. I think I get where you're going, and I know we're out of time, but I'm not witnessing much. Harvard used some political capital just to take the Trump administration to court. And they did seem to gain a lot of political capital with the accolades coming in of, how you're standing for academic freedom. But I think at some point there was a calculus that was not going to cover the billions of dollars that were going to be lost. But I think in academia writ large, we rely on academia as a place for energetic debate, and universities should stand up for that. But the current climate is, a very important lever is being used, which is the financial viability of universities, and public health is particularly vulnerable. So I'm sure that compromises that nobody wants will be made. So I don't, that's the problem, right? The model for university, for the funding of public health is not one that I would have chosen, which was tying it all to federal grants and the overhead that was generated from federal grants. And as a result, we are now witnessing a vulnerability. So I think that people build political capital by speaking truth to power, but it is not enough to offset the economic price, and I don't know the solution for that. But there was some good news for Harvard yesterday. They won a case, the first round. I'm afraid it is the first round. So there was some good news. All right, I want to thank you all for your attention.
Thank you.